Welcome to another episode of Dental Talk 360, a podcast that was curated by a team of dentists to make dental topics more understood by our patients. In today's episode, we are going to be focusing on the topic of cosmetic dentistry, which is a branch of dentistry that focuses on dental aesthetics, facial aesthetics, without compromising the patient's oral health and with respect to function and the health of gums and bone. And today we have our team of dentists with a special guest speaker, Dr. Gerard Lemongello, and he will be kindly discussing topics with us today. Dr. Gerard Lemongello has been in private practice since 1987 in Palm Beach Gardens, Florida. His focus is on cosmetic and comprehensive restorative dentistry. He is a senior clinical instructor with the Rosenthal Institute at NYU and is an accredited member of the American Academy of Cosmetic Dentistry. We thank you for coming today.
Thank you so much, Nicolette.
And I'm Dr. Melanie Silvestrini. This is Dr. Oscar Sanchez, Dr. Barton Santos, and Dr. Alfredo Arauz. So let's begin today's talk. So Gerard, Dr. Lemongello.
That's fine.
What is cosmetic dentistry in your own words, and why should a patient consider cosmetic dentistry?
Okay, so cosmetic dentistry is almost a perspective of dentistry. I almost prefer the word, facial aesthetics or aesthetic dentistry versus cosmetic, because cosmetic has a tendency to lend itself to something more artificial or something that's not as long-lasting, the change of cosmetics and things like that. So I think of cosmetic dentistry more as facial-related dentistry or aesthetic dentistry, where a person can improve their overall appearance by improving the aesthetics, the shape, size, color of their teeth to improve their overall appearance of health and improve their overall self-esteem or the way they feel about themselves.
I think that's an excellent way of describing it. Would you recommend cosmetic dentistry to everyone, or do you think cosmetic dentistry should be considered by patients who really need it?
So I think that patients should be seeking aesthetic or cosmetic dentistry kind of on a wants and needs perspective, kind of both. Not everybody needs, cosmetic or aesthetic dentistry. Often when I speak or interaction with some of my patients, it's about what they want. I often ask, what is it about your smile that you're unhappy with, or what would you like to change? If a person is happy with their smile and happy with the aesthetics of their teeth or shape, whatever it is, whatever color they are, whatever shape they are, as long as they are happy with it and they are satisfied and it is not a health concern, then I would tell them that no, you're not a candidate for aesthetic dentistry. If anything ever changes or you want to make an improvement of some kind, then just let us know. So not everybody is a candidate for aesthetic dentistry. But then there's many people that they want whatever they want to change. So if somebody is unhappy with the smile, the shape of the teeth, the color of teeth, well, it sounds like now you're a good candidate for pursuing what might be in your best interest to improve your smile.
And what do you think is the difference really for patients to understand between full mouth rehabilitation and typical common cosmetic dentistry such as veneers, crowns, bridges?
Okay. So cosmetic or aesthetic dentistry could be as simple as just whitening your teeth and improving the color of your teeth by whitening. It could be as simple as, there's a diverse, group of procedures that are done to improve your teeth and the appearance. Like I mentioned, the whitening. It may be something like you do need some simple bonding, bonding being sort of a plastic color material that is very tooth-like, lifelike in its color and appearance that could be added to certain parts of teeth to improve their appearance. Maybe not, as collective as doing something, more involved. And then it can segue into things like cosmetic dentistry being porcelain veneers, where you can now really alter, simply alter the size, shape, symmetry, color of teeth, fix chips or worn areas of teeth to improve the aesthetics that way. So as you continue down, as you start from simple whitening all the way through, cosmetic bonding or, tooth bonding to porcelain veneers, to segue into the difference what that is versus a full mouth restoration, that may be somebody who has significant changes, wear and tear of their teeth, significant decay or, gum or foundational issues to the health of their teeth those people may need more comprehensive dentistry, where all of their teeth, or significant numbers of their teeth, may need to be repaired, restored, altered in some way to improve their overall dental health.
There's so many branches of cosmetic dentistry, and there's many individualized needs as well. And so I think we can all agree that the consultation is very important. I just want to elaborate a little bit on how we each go about our consultations, and what should a patient be aware of or research before going to a consultation.
I think the question that Dr. Lemongello asks, the question of what aren't you happy about your smile, is very important. Right. Because we need to make sure that, one, we're able to address their expectations of what they want, and two, be able to see their overall health as well. But making sure that the person's actually unhappy versus just saying that you need veneers is very important, because like he stated earlier, they could be happy with the way they look, and you might, as a dentist, might say, okay, it has these imperfections that I could fix, but don't forget that maybe they're happy with that gap in the middle of their teeth, and that's what makes them happy, or a chip. I've had a friend of mine that I've known for 20 plus years that has a complete chip in her front tooth, and I've always asked her, hey, do you want me to take care of it? She's like, no,
I think we've all had patients
I'm happy with that, right?
So
I'm going to ask Dr. Lemongello a question. In your experience, what are some of the things that when a patient comes to you that isn't happy with their smile, what are some things that they mention that they're not happy with?
Okay. So the experience in my office for a new patient, consultation, or someone coming in and who's concerned about the appearance of their teeth, or like you mentioned, they may not even realize there may be some dental issues. It has to be a comprehensive experience. In other words, we have to take the time before they even come in to find out what their expectations are, and what it is about their teeth or their dental health that they're concerned about. When they come into the office, they need to be met with the proper people to discuss their health and what their teeth are like. And then the process in my office, the experience in my office, is that they come in, and then I will spend time with them specifically to sit down and ask them, well, what is it about your teeth that you'd like to change, and what would you like to improve, or whatever. So that experience starts with questions from me, because it's not about what I think they want. It's not about what I think they need. It has nothing to do with that. It's all about what the person's want is, what their desire is. Now, it may be that a person comes in with significant dental problems and doesn't perceive they have any. So now I get to switch hats. And even though I may be asking questions that may lead into trying to make some decisions, well, my ethical obligation at that point in time is to make them aware and bring them aware of things that I see, some dental treatment that they may need. Now, we're back to the same thing. A person doesn't need anything, okay? It's a matter of me explaining what is in their best interest, what would be the best for their dental health, and them making the decisions of what they want to do, how much treatment they may be interested in. That's an important concept, because I'm not here to tell a person, you need to fix your teeth, or you need to do this, or you need to do that. It's really all about their experience, the process. I don't like the word educating, but guiding them into what dentistry has to offer to improve their dental health, overall health, okay, and going from there. That's what the experience has to be.
I agree. And I think that's something that in Dr. Barton, in my practice, we do that. We do that pre-consultation, which is so important because it allows us to ask those questions first to see how they're doing. We have a Panorex that gives us a general idea of what things look like, but we really want to dive into their health. We got to make sure that, health-wise, and what are their habits. I had a patient the other day that was a simple two front teeth restorations, and I had a 30-minute consultation with her because I saw these wear patterns and these habits, and because of that consultation, it led to me having to do Invisalign first, because there was oral habits, oral fixation. She was wearing a device for her TMJ, and if someone would have moved forward and not done that, it could have broken those teeth and caused issues, So it's important to definitely, as Dr. Lemongello does in his practice, ask the right questions, make sure that you're guiding them in the right aspects of their general health, because it can lead to complications and an upset later if you don't. Because at the end of the day, we as practitioners need to make sure that we're doing what's best for our patients ethically and in their health, because that's the oath we took. And it's important to make sure that we do our jobs as far as guiding them the right way and looking at the whole picture in order to give them the best experience, one, and then two, to really listen. Because I think that's an issue that some of our colleagues, unfortunately, they don't listen to what the patient's saying. They're closed-minded in the sense where this is what they want to do, this is what they're used to doing, and that's it. No, there's a person there, and that person has to live with your treatment for the rest of their lives. And it's really listening to them and being able to then guide the expectations in order to give them the right outlook and then the right smile for you, right? So I think that's important. What are your thoughts, Dr. Bart?
Yeah, I mean, something as simple as asking a patient, a friend, or a colleague, do you love your smile?
Mm-hmm.
It's as simple as that. I mean, anytime I go out, friends introduce me, oh, Dr. Santos, he's a dentist. He's not a real doctor. But I always ask them, oh, do you love your smile? That's it.
Yeah.
Simple. You love it? I love it too. If you don't love it, what don't you like about your smile?
But it's incredible how some of the offices don't do that, though.
Yeah, it blows my mind.
They just don't do that. And it will really make a difference for everyone. And the aspect of dentistry, because I have patients that come in upset all the time saying that, oh, I was given this treatment plan and and I get this, they never actually listened to me.
Yeah.
Right?
Well, if I can add to that as well, I mean, I practice and live on a philosophy of know your patient, okay? I mean, I was trained in this way. Know your patient. Unless you know your patient, what their needs are, what their wants are, what their desires are, then you can't offer the proper, solution, okay? And often I say, don't offer, a solution to a problem a patient doesn't have or a patient doesn't know or understand they have yet. That's up to you to guide them as to what their needs may be to improve, improve their smile, improve their health. And those are foundational things to live by. Know your patient. Like you mentioned before, many patients go into, depending upon what type of, clinic or office it is, that the minute they walk in, they're bombarded with what their needs are.
Mm-hmm.
You need to do this, you need to fix that. And it may have nothing to do, it may not even be the right treatment if someone hasn't evaluated the true extent of what those people need. You mentioned full mouth reconstruction earlier. Well, how often do we see that somebody walks in with a problem, I broke a tooth or I have some discomfort, and what does the dentist do? They immediately fix that problem. Okay?
Right.
But if they haven't taken the time to know their patient and get to understand what their overall health is, you may be fixing a tooth or fixing a problem that you've never fixed or evaluated the underlying problem or cause that resulted in that broken tooth. And until you fix the underlying problem or, get into that understanding or realm, you are now just repairing something that you're going to have to repair later. Or that person is going to have the same failure later. I often make these strange analogies that people understand. It's like the front end alignment on a car. You walk in, you drive in, you got flat tires. And you say to the person, well, give me new tires. So they get new tires. Drive out, well, next week they got flat tires.
Exactly.
Well, until you fix the underlying problem, the front end alignment or the other suspension problems or something else that's causing the underlying problem of the failure of the tires, you're never going to get good health or get to the bottom of it. Teeth are no different. If you are not fixing or treating the underlying problems that are leading to this, gum disease, decay of teeth, those things that are causing down the destruction and degradation, and you're just fixing one problem, and all you're doing is jumping around a person.
Yeah, you're basically putting a Band-Aid over
That's
it.
all you're doing, okay?
I agree.
So that's how you lead from something like simple dentistry to someone who has all these underlying problems that they've been to dentists, and unfortunately, dentistry has failed them because they've put out fires. They've fixed little things, and then they're constantly in the dental's office saying, well, you fixed a broken tooth last month. Now you're fixing a different one. Now you're fixing a different one. That's where somebody needs to step back and realize that perhaps they're not in the dental office that has the right perspective on overall or comprehensive health that we heard and we talked
Dr. Lemongello, that also leads to the practitioner not being trained enough to see those things.
Absolutely.
Because you'll get somebody that's like, I was in my doc for 35 years. They never saw any of this. And at that point, I have to take a step back and, say, maybe they just didn't see what I see.
Right.
And then it's my job to guide by showing photos and CBCT scans of degradation of bone. And, and it's especially if you just met the person, it's very difficult. If you've been treating them for 10, 15 years, you could show them things changing over time. You know,
I find ourselves saying, I say to my patients often, you know, you have a new person that's in the office, they don't know you, they don't trust you, they haven't seen you yet, you know, and I'm a person who likes to just be upfront and address, you know, the elephant in the room or the situation. And I often tell them, you know, you've given me the hardest thing in dentistry. You've been seeing your dentist for 30 years, okay? Has your dentist ever discussed with you these worn teeth, these old restorations, these breaking teeth? No, I haven't. So no one's ever discussed this with you. So you're leaving me. This is the first time I'm meeting you for the first day today. And now for the first time, someone's going to open the book to you and enlighten you of all the issues and problems that I see now. And it's really a very, very difficult situation to put yourself into. But it's our obligation, no matter how uncomfortable it is, no matter what their experience has been. It could be their uncle, their brother, their best friend. But if no one's ever explained to them what their health problems are and what will lead to better health, you know, and what the future has, you know, to hold for them, then dentistry has failed those patients.
I agree.
So I'm required to say, I have to give you the hardest thing in the office today, is I have to tell you something that you've never heard from a person that you don't know.
We can all agree as practitioners that we treat patients in dentistry comprehensively, and I think that's really important for patients to understand. With that, actually, can come some misconceptions in dentistry where a patient who has seen another provider comes to a new provider with misconceptions. What are common things that you guys have encountered in patient consults? Some misconceptions that may have affected the treatment plan or the way a patient thinks about the treatment based off your experience. Is there anything you can think of?
I have a lot of patients that, one, they've been told that, you know, this is supposed to last you forever. You know, that's one of the main misconceptions, or even with implants, with regular dental work, is the previous dentist told them that this is going to last them pretty much all their life. And we come in and they're like, oh, well, this crown broke, and, you know, it's supposed to last all my life. So that's one of the main things that I always like to tell patients, is that nothing that I'm going to do is going to last you forever. Your teeth did not last you forever, so I am no better than, you know, whoever created it. So that's for me, that's why it is.
Yeah. I always tell patients, you know, set the expectations realistic. There will be revisions down the line, depending upon your wear and tear and your habits. If you have patients that like to bite their nails, and you do, you know, full set of beautiful veneers, they're not going to last as long as someone else that gets their veneers done and doesn't bite their nails. So different habits. But I always let the patient know that, you know, we're going to go through this journey together. I'm going to be with you. And I'm still young, and I plan to be here for a while. So, you know, when those revisions happen, we'll go through it together, and we'll update those things. But typically, you know, veneers will last 10, 15, 20 years. Gerard probably has cases that are lasting older than me.
Well, when I find sometimes misconceptions, you know, again, in the process that we have people, you know, come into our office and the experience that they have, I often hear things like, well, my dentist told me that I can't do that, or I can't have this, or I can't fix this. And I find it intriguing when I hear that, because I don't think in today's world of dentistry, with the technology we have and the resources we have, the materials that we have, that I don't believe there's anything, you know, obviously within reason, I don't think there's almost anything that we can't do or can't offer a better solution to in regards to their dentistry, their dental health, their appearance, you know, all of that. I just, you know, it troubles me when I hear someone say, well, someone told me I can't have veneers. Well, why did they tell you I can't have veneers? Well, they just told me I can't have them. Okay, well, that may be more that you can't have them because this doctor is not trained in doing porcelain veneers, or they just look at it as, well, that's something I don't do, so that means, you know, well, that you can't have those. Or someone may realize or think, well, you know, veneers don't work, which is another thing I hear all the time. Well, veneers don't work.
Yeah, my
veneers don't offer. Okay, so, you know, if I share in this audience, you know, my veneers are 26 years old. Okay, so if anybody can attest to veneers working, well, my veneers are 26 years old at this point in time. So when I hear veneers don't work, no, what that means is the person who provided you veneers either didn't know how to make them work, or they weren't trained well enough in order to make them work. There are things that, it's true. You can't have veneers if there's not enough strength of tooth left, if there's not enough structure of tooth left, if you don't have the right bite or the right health, then you're right. You're not a candidate for veneers. You may be candidate for something else. I know you brought up Invisalign, okay? And maybe we can end
It's a great topic. Yep.
Invisalign or orthodontics. There's also the misconception that everyone has to have orthodontics first before they can have porcelain veneers or something else. It true is a misconception. There are times where Invisalign and orthodontics is the proper treatment, the proper protocol to do, foundational positioning of teeth, or putting them in the right position so they're in the best alignment. I heard I used the car alignment before, to put the teeth in the best alignment so that you have to treat less teeth, or that they're in a better position so that they will last longer. That's when, Invisalign and orthodontics is a viable option. However, there are other times, if I have a person where, back to the full mouth restoration scenario, if your teeth are all worn, if they're significantly decayed, if they are broken and chipped, okay, and they are misaligned, by the time I now make you go do orthodontic treatment and move the teeth and make you spend a significant amount of money and significant amount of time, only for me at the end to tell you, well, now it's 2 years later and, you spend $8,000, I still need to restore every tooth in your mouth. Well, what I've done is I've misinformed you, and I've let you go on a journey of spending money and time that was unnecessary, okay? So instead, those patients, I often ask, and many other people that I consult with and teach with, is what's the value of that treatment? Every dentist needs to sit down and think about, when they're recommending dentistry and some kind of treatment, what's the value of that treatment? Okay? Root canals versus implants. What's the value? If I'm going to make a person significantly invest in a tooth with a poor prognosis with a very few years of life left, is it correct for me to invest, or have that patient invest a significant amount of money in root canal therapy on a heroic restoration to try to save a tooth, when they may be better served by removing that tooth at this point in time and placing a dental implant and doing something that is going to be more prudent and last them a significantly longer amount of time? But again, that's our obligation, deciding what is the right treatment. Orthodontics is great treatment when it's properly applied. Most of the dentistry we do is great treatment if properly applied. Okay,
I agree.
So those are important.
A misconception I get a lot is, if you're going to do veneers, you're going to shave my teeth down, right?
Yeah.
Or I grind my teeth down completely and now you got to shave my back molars. Yeah. And with as Dr. Lemongello stated, the technology that we have now in adhesive dentistry, we could do as minimum preparation as possible, even on those posterior teeth. I actually tell sometimes to my patients, you already did half my job for me because you ground them down. And,
And it's usually those patients, the ones that are mostly scared of you grinding up their teeth.
Yeah.
Everything's flat. I'm not doing anything.
But then it's guiding them and letting them know that, no, I don't have to. And then showing them that what you're doing is just doing the reduction necessary for the porcelain that you're going to add on. And that, again, goes to training, right, Dr. Lemongello? It's the training of the practitioner to know how to prepare the teeth properly, what tooth needs to be prepared mostly, and to kind of circle back with the Invisalign. Sometimes the corrective orthodontics with Invisalign is to help reduce the amount of enamel that you have to remove or anything in order to put those teeth in the proper position, or as we call arch form in the mouth, in order to not be able to have to reduce as much dentition, right? So, and I think it's important for us to preserve as much natural tooth as possible, because going even further back, as Dr. Santos mentioned, we're going to have to revise that case in 15, 25, 30 years. We need to have tooth structure, sound tooth structure there in order to be able to even do those revisions. So as a practitioner, it's important to think of long-term. I'm treating this patient. I want to be their lifetime caregiver as their dentist. I know that I'm going to have to retreat this case multiple times in my career. I want to make sure that I put this patient in for success, whether that is putting them in Invisalign if they have a lot of crowding in order to reduce the amount of tooth structure I have, or if they're completely worn down. preparing the teeth only where you absolutely have to in order to put the restoration in the right position so that they could occlude properly. And then using the right methods and techniques in order for that case to be successful long term, not addressing a single tooth, but looking at the whole picture, right? I think that kind of circles back.
Dentists have such an important role in the whole process when it comes to function. And now we can talk a little bit about aesthetics. And a very common question that patients have is about how white can my teeth be? Now, I'm sure we can all agree as dentists, we appreciate natural looking prosthetic work, and we take pride in working with ceramists who can help us achieve that. Now, how involved do you guys keep your patients in that process with choosing the shade? And what do you recommend for patients who come in and they want really white teeth? How do you go about your consultation process in choosing the shade?
Dr. Lemongello?
Well, that actually is a great question. So I want to almost say that I keep them involved as minimal as I can. Okay.
That's where our patients have to trust us as providers, right?
Exactly. So the answer to the question is you can have teeth as white as you possibly want. Okay. If that's what you want, and we get all ranges of this. I have patients who walk in and say that I want a natural smile and natural shades and colors, and that's fine. And I get people that want to come in, and no matter, I can't provide them something white enough to give them or satisfy them. So we have all of these, but part of it is, again, back to asking the questions. I will ask a person, so, what is about your smile? And then we get into a conversation about color. What is your expectation? Do you want Hollywood white teeth, as white as they can possibly be, or do you want something more natural, something more age appropriate, something healthy, and something would, people would look at you and say, wow, you look great. You have such pretty teeth. They just, they're not like, oh my goodness, they sparkle. Those are the gamut that we, you have to find out what a person wants. But there are, in today's world, again, of ceramics, and porcelains that we use for veneers and the restorations we make, the key is I can give you teeth as white as you want them to be, but I have to be able, you have to allow me some of the artistry of what can make a pure white tooth still look very beautiful and natural. It has to have the proper shape and the texture, has the proper curves to it, has to have some transition of translucencies and different things to it that gives it an artistic or natural perspective, even though it's very white. And then you can do, you can do that all the way down the scale of whiteness to where you can still give somebody very natural teeth with the same thing, the same contours, shapes, textures, some of the, the pretty tones and things that you find in nature. So I involve them in that conversation to try to define what they want. And then I try to educate them and help them understand that I'm going to give them very white teeth, but with these artistic additions to make them look real. Because I know we all meet people, and the people listening all meet people that have these bright white teeth that look just dead. They're dead toilet bowl chip. And
call them air pop white.
And some people, some people, that's all they care about is that they want it that white. But I want you to imagine I can give you that same white chiclet tooth, but if I allow me to do the artistry of shape, texture, and add some highlights to it, I can give you the same beautiful white tooth with a sparkle and a pop to it that'll actually make it look better than that chiclet toilet bowl white tooth.
Yeah.
Okay? But that's so, when I say as small amount as I can let them be involved, they have to be involved because they have to share with me what it is that they want. But, that's where
they have to trust your expertise.
They have to let me guide them as to what it is that again is going to work for them. A person with light complexion has to have a different tooth color than a person with a dark complexion. Because I want you to understand a person with a dark complexion and an incredibly white tooth does not work. Okay? The contrast is too grand. Okay? So those have to be considered. Person with very light teeth, blonde hair or gray hair, blue eyes, has to have a different type of whiteness and color to that person that we have to guide them on. So
I agree. I use the analogy of a frame. So if you have a black frame with a white piece of paper, that looks really, really white. But if it's a white frame and the white piece of paper, then it blocks out. So as you stated, you have to look at all of those factors in order to pick shade. Yeah, the patient has to be part of the conversation because it is their treatment. But ultimately, at the end of the day, the conversation needs to be had up front that they need to give you artistic and creative ability in order to add those line angles. Because a lot of it is just all an illusion of line angles and light reflections, because teeth are, enamel in essence is a glass shape. When you get those hyper white teeth, you lose that. You lose that ability of being able to have zones of reflection and lights. When they're smiling, everything looks natural to them. So adding those nuances, as Dr. Lemongello mentioned, would really enhance them, even if they are choosing a hyper white color.
Like if you think about it, again, a tooth is a three-dimensional object. Okay, let's think of a diamond, right? Okay, there's depth to a tooth, there's character to it, there's facets to a tooth, just like that beautiful diamond, right? You'll take them, ladies will look at a diamond and be like, oh my God, how beautiful is that? Well, that's because of its depth. Its depth and its character is what's giving you that beauty. So a tooth is no different.
Sure.
Okay, has to be the same type of thought process.
Agreed.
Okay.
I think that's an excellent analogy. I really like that.
Yeah, that was really
Characters.
good.
This is exceedingly long up. The pearls. Okay, so
Yeah, Dr. Lemongello, excellent. You definitely have a way with words. Now, in a patient consultation, what have you found to be the most successful part of communicating this to a patient to have them better understand before them deciding to do treatment with you?
Okay, so you've heard me talk about the experience and a process. Okay, so a lot of that is the way patients are treated before they even come here. So compare, a Ritz-Carlton experience and how you're treated versus, a Motel 6. Okay, so it has to start there because it lends itself to value and credibility of the type of practice you have, to type of practitioner you are in regards to detail and perfectionism, things like that. So a patient will come in. The most significant part is, again, back to me speaking and consulting with them. But I'm in a situation and at this point in my career where I have significant numbers of examples. So if we get into a conversation with a patient of what the expectation is, I have, a library of cases that I've done over the years that allows me to say, okay, well, I can pick probably 5 cases or 5 treatments that are nearly identical to this person. So the advantage is I can sit down and I can actually show real life examples to different people and how we change their teeth or their smile from before to after. And I find that to be, in all things that we have done over all the years, to be the most effective because it's real. So if I take, and I understand in today's world of imaging and all the things that we can create, it's still, there's something about it. And I'm going to use another analogy. So a woman goes in to get her hair colored, right? And they give you the computer and you put the hair colors on and you think, well, this one looks pretty good on me. I think it will look good on me because it's a computer simulation. But once you go and actually have your hair finished or the hair done, suddenly you sit back and you're like, well, it just doesn't work. So that's why I use real life examples where if you come in and want to see a person who has similar teeth to you, similar shaped face, similar lips, tooth shape, and you want something, then I can usually show another example of that. Now, I realize that not everybody has that opportunity. So I would say that use your imaging. There are other things. I don't want to get too technical in dentistry in a forum like this, but there are different ways that you can allow your dentist to show you examples and do things to help you understand. A simple one, it's kind of a quick segue, but a simple one that many dentists do is they will place some a mock-up of some kind on your teeth to let you visualize it or see it in the office. It's not perfect, but it's done to show you in your own face what it would look on you before it becomes the permanent solution or what you're going to move on. So in my office, it's either show existing cases of what I've done in the past, real life situations, or do this type of mock-up where I actually just place materials on your teeth, shape them lightly to give you a kind of a preview of what your teeth and smile would look like. That's very effective as well. So those are some of the two things that I do.
Yeah, I agree. And then doing the mock-up is also very powerful, as well as showing documentation of the history, right? With someone with your years of experience, you do have that library of imaging. Another effective one, if let's say the teeth are super malpositioned, it's important to take intro and extra-oral photography, maybe do a 2D drawing of what they could potentially look like. That's a different method as far as mocking up when you can't. And then there's digital mock-ups that we can now do depending on your practitioner and what their skill sets are. But the very powerful ones, as Dr. Lemongello mentioned, is showing your previous work of cases that are similar, and that way they could get a feel for it. And that intraoral mock-up is something that is...
Because dentists are also, they provide individualized treatment for individual patients, but also I think every dentist has their own style as well. And so that's something that patients can also consider when choosing a provider. You guys want to elaborate more on that?
A lot about the patients, some of the things that I say when I'm talking and I'm interviewing them, we're both interviewing each other. They're interviewing me to see if I'm going to find their work. I'm also interviewing them to see if I'm a good fit with them. I like to ask them what they find, what their definition of beauty is, and they can show me pictures. I've had patients where they show me teeth that I just don't find them attractive, and that's what they find attractive. But we keep showing me photos and photos of the same thing. So I'm like, sorry, but it's not going to be a fit because I want that monochromatic, white, fake look that I personally don't like. So that's also, where I will put my interviewing cycle. But like you guys were mentioning, for me, the stronger tool is to show them what you've done. That way they can see your style. And if it's something they find beautiful, most of the times they want to be for the treatment. Now, as long as you have that backup of cases that you can show, for me, that's the most important, strongest tool that we have.
Is that the same as well for you, Dr. Santos?
Yeah, so the interesting thing is I was listening to a TED Talk on one Harlem drives to work. I can live in South Beach. But it's just this battle with variety. When you show a patient, if I were to show you the tooth guide, all these different shades, and when it comes to comprehensive facial aesthetics, like Dr. Lemongello said, you got to take into account, skin tone. Like, I'm a pretty tan guy, so I'm not going to go like OM1. I know I'm going off on
the whitest white.
The whitest white. But when you're choosing a dentist, you're choosing an artist and you're commissioning them. I always give patients just 3 shades. I say, I think this works best for you, and here's why. And then I show them the 3 and I let them choose the 3. I guide them in that direction. Because when I first started off, before I met Gerard and I got trained by, Larry, Rosenthal, Gerard, the whole Aesthetic Advantage crew, I used to show everything. I used to, which color do you like? What do you, always OM1, always OM1. Yeah. And I did those cases.
Yeah.
Now I look back, I don't show those cases because, in my mind, I was giving the patient what they wanted, but I should have not led them in that direction because it aesthetically doesn't look pleasing. It was my, responsibility to guide them in a certain direction, and I kind of failed them. So now I just show them 3. It's just like when you go into the TED Talk mentions, back in the 90s when you go shopping for like spaghetti sauce, there was like 3 types of spaghetti sauce. It was just tomato, garlic, and veggies. Now you got tomato, garlic, and there's just 20 different brands.
Man, hungry now.
Yes. But the thing is, satisfaction went down lower.
And it's not about overwhelming a patient. Okay, yeah. I can overwhelm a patient in 30 seconds. I'm sorry, in 5 seconds I can overwhelm the patient. The bottom line is back to guiding, and don't even give them these arbitraries. Guide them and bring them in a direction that you want them to be. About the artistry and the different practitioners and the different things. What I've experienced, or I find interesting, is if I think of the top clinicians or practitioners that I'm aware of throughout the entire country, all the way from New York to Florida to California, to Northern California to places, Arizona. There are some significantly talented clinicians and dentists in our country and throughout the world. What I notice is that beauty is beauty, okay, and perfect imperfection and artistry is, even though it's different, it's similar. So if I look at if I think of 10 guys and I look at all their cases, what I find is similarity in all of them. They may have little things that are a little different here and there, but the top clinicians all have similar beauty, similar cues in them, because there is only so much in nature that looks real and works. And I think that, when, the collective finds their way, they find a way to, essentially the same size, shape, contours, different things we talked about earlier. When you start to get the outliers, it's true, as you discussed, is that I have outliers that will come to me and they want something that does not align with what I believe beauty is, okay? And I don't believe that, I will invite them and say that I don't believe that we align in that beauty. If you're a different kind of cosmetic surgeon, right, and someone may come in and say, well, I want my nose to look like this, or I want some other body shape or whatever, I find it interesting, because I think that I think that's where physicians owe it to their patients to say them, no, I won't do that much kind of surgery. No, I won't plump your cheeks this much. No, I won't make your nose that thin. No, I won't make your lips that fat. I believe as dentists, we owe it to our patients as well to guide them that those are not within the realm of what is, again, in their best interest and what is in their best health. Because normally or often when we distort something that far, it doesn't work with the rest of their chewing and eating and all the other things. So I know I kind of segued in a different realm, but
I'm glad you mentioned that ethics. I think it's very important.
Your question there led itself to, what do you like about, certain veneers of one doctor versus another? And what I found is when we get to the top clinicians in this country, they all have similar eyes and artistry towards creating a beautiful smile. That's what it's about. It's not a beautiful tooth. It's not, it's a beautiful smile, but it's even beyond. It's a beautiful smile. It's a beautiful face. Okay. And it's something that works well, functions, but the person can use. I mean, I can give you a beautiful smile, but it can't bite your teeth together. Okay. You can't chew your food.
Exactly.
And that's what's important, as Dr. Lemongello mentioned, is guiding the patient to their health. Because unfortunately, most patients don't have a high dental IQ. They wouldn't know just because they look at a photo and they're like, that looks great. I could show a photo of the top practitioners in the country and then the ones who we believe aren't, right? And they'll think, some of them might think that the ones that aren't have the nicest looking teeth because they're just whiter and whatever, but they're not going to function properly. But that's because they were led that way, right? So it's a matter of guiding them properly in order to give them the best results without letting because a lot of it's also psychological. We have patients that have unrealistic aesthetic expectations, and we need to know how to filter those patients out, because those are the headaches. And many of have had
is the unrealistic. It happens too. I'll have some young person come in and show me, Julia Roberts' teeth or smile, and say, well, I want Julia Roberts' smile. And I say, well, it's wonderful. I can't give you Julia Roberts' smile. You don't have the same skeletal structure, same face structure, same lips. I want to be Tom Brady, okay, but I'm not. I'm not 6'2", and I can't throw a football like that. So no matter what physician I walk in, they're not going to make me Tom Brady. Well, no matter what you do, I can't give you that celebrity's teeth. I can get you something close to it. I can give you what I believe and interpret you're asking me to give you, which is a beautiful smile that fits you and your lips and your face.
Exactly.
Okay, not Julia Roberts.
It's tailoring it to them. It's tailoring that to them. Like my analogy.
We see this in Miami a lot.
Yes.
But we're here in Miami, I have a lot of places where patients come in. They know this clinics where they just do they do teeth day in and day out. And then when I look to the Instagram, then I show them, let's take a look at it together. And I tell them, look at this teeth. Look at the way the light reflected, because they always take a picture the same way. And you look at every single tooth, guy, girl, everyone, older, and they all have the same coherent sounding tooth that reflects light. And everyone is carrying the same tooth until your face is not the same as his. So
it's a very good point. I want to bring this to another hot topic, because a lot of patients have questions about this. Now, what goes into the whole quote of the price for veneers? We're dentists from different locations, and we probably have viewers from all over the world right now. So I think this is something very important to bring up to topic.
Okay. So all veneers are not created equal. all practitioners are not created equal. Okay? I mean, that's really what it comes down to. So I often say to a person, why is the fee the way it is? Well, I'm also going to say that every doctor, I believe, knows what their value is and what they're worth. Okay? So if you're a top neurosurgeon from Johns Hopkins University or the hospital, you have a different expertise than, and I'm not diminishing anybody, but someone who does not have the same credentials. So would you expect the person at Johns Hopkins to charge the same amount of money or whatever for their talents and expertise as a doctor who's not as significantly trained? Well, dentists are no different. Okay, so the fee is going to be based on a few things. One is going to be if I collectively say time, talent, and expertise. Okay, the fee is based on my expertise, my experience, the level by which I'm going to, and the time I'm going to take to invest in that person and in the smile and the dentistry I'm going to do. As well as, not all ceramists, the people that create the teeth for us, are all not the same. They too are the same example as the physician. The top ceramist in the world is going to charge more than the ceramist who might be around the corner, because he is creating a piece of dental art, is what he's doing. He's a Michelangelo who's sculpting a tooth for us. So he's going to charge me a fee commensurate with his expertise. So if you have a doctor who has credentials and expertise, okay, and takes the time to know you, all right, and he uses one of the top ceramists or artists in the country to create your smile, well, that's going to cost more money. And I think that other analogies, if you go into a store and you're going to buy some item, right, it's always you get what you pay for. You go into Walmart, no offense to Walmart, you're going to get a certain level of quality of clothing, as opposed to if you go to some of the top designers in the world and what they create. And everyone understands that those are not the same. So a fee in where I practice is still going to be based on my time, talent, and expertise. And I believe that everybody, no matter where you are, that it should be that way. Whether you're in Kentucky, okay, or if you're in South Florida, if you're in New York City, okay, or you're in Oklahoma, okay, the bottom line is you should be finding the most talented doctor or dentist in your vicinity. And it's not about shopping price. It's not about price. The old adage, well, do you want a good price, or do you want, what do you want? You want a good price, or you want, a beautiful result? Well, if you want a beautiful result, then unfortunately you have to, there's an expense that's connected to it. So that was a long answer.
No.
But that is the perfect answer.
It's
And
the
I
perfect
agree.
answer.
100%.
And that actually brings me to one of our audience questions. It's very related. One of the audience members asked, what is your perspective as a dentist in going overseas as a patient for dental procedures to
That's
save
a perfect
money?
question. Love that question.
Me too.
Okay,
Let's talk
we
about
happen
it.
to be here in South Florida, okay, and so I'm not practicing for a long time, okay. So we happen to live in a geographic area that people often will say to me, well, I can just go to South America, or I can go somewhere else, okay. So we can go back to a couple of things here. Number one is back to time, talent, and expertise, okay. Again, not to diminish any doctors in South America, okay. But are they trained the way that we're talking, this collective is trained to give you the expertise that you need and require? That's number one, okay, is what is their training? Okay, how well are how well did they do this? How often do they do this? The next is, so you're going to get on a plane and you're going to fly to wherever you're going to go. And the doctor is going to, in a fell swoop, in a week's time, he's going to do all your teeth and fix everything in a time frame that is expedited and shortcut and everything else, and you're going to get what you get, and you're going to get back on a plane, you're going to fly back to the United States. And now when you're here, something breaks, something gets infected, something doesn't fit right, and what are you going to do? You're going to get back on the plane, you're going to fly back to South America, or, I'm just using South America as an example, to continue to go back and forth, back and forth, back and forth to repair or fix whatever the issues are. Now, I've been experienced long enough that I've had many people come from doing this, only to find them come to me for me to now fix it, okay? And unfortunately, unfortunately what I find is the level of expertise in some of these other countries is so low that they create more damage, okay, to our patients, that now what they need is far more invasive or needs far more expertise in order to correct all the problems that have occurred. So don't get me wrong, there may be some fantastic clinics that are worldwide that you can do this, but my experience is not with the before.
With those clinics that are there, they're charging the same as here, because those practitioners take their time.
Now, and it may be yes or no. I'm aware of some that it's a wonderful deal. You get on a plane, they're going to put you up in a wonderful hotel. They're going to chauffeur you back and forth. It's the Taj Mahal. They're going to take such great care of you, and for a fee that you can't possibly charge to do. You can't. And I spoke to you before about talents of ceramists. Okay, so let's just, for argument's sake, this veneer done in one of those clinics costs the clinic $50 to be made. Okay, and in the United States, because they're not using my the same ceramic or the same artist, mine is $1,000. Well, how on earth can somebody give you a beautiful smile when the ceramic costs $50 versus a person who the ceramic in my case costs $1,000?
Exactly.
Okay, so 10 teeth. You guys can do the math. There's no way I can charge the same, but they're not the same. We're back to getting what you pay for.
Agreed.
Okay. What are you going to get for $50?
It's not only what it looks like too, right? It could look pleasant in many scenarios, but it's also what is done underneath.
Then the maintenance, and then a lot of doctors, they'll come in with issues and problems, like things broke down or there's infections now, and a lot of doctors are going to be hesitant to even deal with that, because if you open, as we know, you open up a tooth, that's your problem now. Right. So you have to be able to understand that whatever you do to that patient, whether you're adjusting that bite or anything else, now you hold responsibility of what was done by someone else. So you need to look at that whole situation, even if they're looking for maintenance. Like, is that something that's maintainable? Is that patient going to truly go back and forth for maintenance?
That's a very good point.
Because I will find that a lot of top clinicians will be very hesitant to maintain any of that. And it's very difficult for those patients sometimes too, because they are paying for what they're getting, right?
And a lot of the time it also has to do with the way that everything is done. It's not just the outcome, what he sees, also what's underneath, how they did the procedure, how sterile everything was, and their protocol. And a lot of the times, they can go, if, especially if the bite is somewhat okay. This veneers could last you, 5-6 years, but they'll look what's underneath. Because I find that a lot of the times, there's cement everywhere. They can't even floss. All the teeth are together, like one single unit. And then when you take x-rays, you see huge amount of decay. They're not going to notice because it's a slow process. So then when it comes to you and you take it out, then you see this tooth that's completely destroyed. So now I'm already, it gave the first shot to that dentist over there. So they started in enamel right here. And now I'm starting over here.
You're getting set up for failure.
Exactly.
And what is the intention of these practitioners overseas to maintain relationships with these patients, especially in situations where they're doing full mouth treatments? So that's a really good point that you mentioned.
I don't think there's any intention for them.
Exactly. And that goes to show you.
When we talk about healthcare versus money, I mean, it sounds to me as if, this type of dentistry is strictly founded in the idea of economics, business, and money.
Yeah, I agree.
That let's get people to fly in, let's do the cheapest that we can possibly do, okay, and then, we made our money. Okay, that's what it's founded in, as opposed to our patients who, if I did this kind of dentistry, I'd be out of business in a week. Okay, because our practices are founded on our reputations, and things like that. We have to now live and or treat and retreat, and take care of those patients. And if they were back every week, there's something broken, something falling out, infection, gum problems. It wouldn't work.
No, it's not feasible.
It would never work.
A lot of these doctors, they don't even, because I've had patients, friends of mine, that have come to me and I've given them, an estimate of everything. Then they decided to go overseas. They have period disease. They haven't gotten teeth cleaned in years. And then they go and get it done in 3 days. I'm like, you were supposed to have this treatment prior to. You went here, you got everything done all at once, probably bleeding everywhere. So already, you're already starting on the bad situation. And then when they tell me how much they pay for, I'm like, that's not even my lap fee. I tell you about
But again,
Right. We can't create a single tooth for that amount of money. It's just not possible to do. So, it's the collective is more that, I don't want to say it like this or be this way, but you're almost better off seeing the person who has a higher fee, because that's the person has the ability, has the knowledge, skills, expertise to do what is best for you. Okay, just again, like those other analogies of, if you're going to, if you have some ailment that's wrong with you and you need to see the top doctor in this country to see them to save your life or whatever it is, you're going to see them. It's not about money. It's about the best care you can get. Well, dentistry is no different. People think, dentistry is just teeth or it's a commodity, but it's not. The fee is commensurate with the expertise of that doctor who's providing that care and the follow-up care. Okay, and my cell phone has, if I were to tell you how many patients will contact me directly, we talk about, my practice, concierge doctors didn't exist, when I was growing up, but our philosophy, the type of practice I have, it's almost my patients know that they can call me, okay, and we will arrange what they need. I love stories, of patients and their experience. Someone calling me from, Italy. I broke my tooth. Okay, when you coming back, I will have everything. Everything is already ready and set up for when they return. And everything's in order. Everything is concierge is already done. It's already taken care of. They walk in, everything is set up already for them to be taken care of. There's no delay. There's no guessing or downtime what we need to do. So.
In the cosmetics, also with the surgery, a lot of patients are going down to get implant surgery. I had a friend of mine that he got like 3+ plays. He came back with a panel printed. Implants look beautiful. I take the 3D for the one implant, completely outside of the bone, just held in the gum, just completely out. The other one I had removed last week also. It's.
And this is not to badmouth overseas. Now in the United States, this brings us to another topic.
If you want to see, okay, and go overseas, okay, well then call me, because I'll tell you what, I know throughout the world,
some talented,
clinicians that I would be more, if that's where you want to go or that's where you're home, then I would be more than happy to refer you to the best clinician that I know in your demographic area.
Agreed.
Yeah.
The bottom line. Okay.
You can find that in the United States as well. You can find it anywhere. And in the United States, we have other aligner companies. This brings me to our second audience-directed question on those clear aligner companies, such as Smile Direct Club, to name a few. What are your thoughts on how it functions based off of your knowledge on these companies? I have some knowledge on these companies myself. Now, I haven't had any patients directly use these companies, but I'm just curious because this is a question a lot of patients have, and it's directed also because of monetary reasons. So
I feel the biggest issue is not having a certified dentist monitoring the care and the treatment, looking at periodontal disease, making sure that they don't have bone loss that could lead to those teeth to be lost over time. Making sure that someone's checking in on them all the time. A practitioner that actually did the case to put the teeth into the right position. That's where a lot of these issues can lead to, especially when they're just taking a mold of their mouth at home and there's no one there to make sure that the mold's properly done.
right.
That's not even easy to say.
Yeah.
No, that's not easy. They're not.
I don't think any patient should ever have to take their own impression.
Yeah.
And then there's, with orthodontics, there's movement of teeth through bone, right? So it can lead to bite problems that could then lead to, neuromuscular issues down the road. So it's important that the patient understand that the purpose of us monitoring your case is to make sure that everything's done perfectly so that you get the best outcome that you're looking at without a rebound effect, meaning the teeth will go back to where they were, or you have a catastrophic issue where now you had bone loss that you weren't aware of. Some of these patients, unfortunately, aren't seeking dental visits because they might be scared. Right. And it's been 20 years since they've gone to the dentist and don't know that their lower teeth have no bone. They're just being held by their gums. And now they move them, and now they're gone. And that leads to a lot more upsets than good. And I think that in my practice, it's my duty to guide the patient, because I've had that question asked to me before. And then I basically say my purpose and for these treatments is to make sure that you're getting the best outcome for your health and for your results, period. And that's very, very important, because if I step away from it and no one's monitoring you, this could lead to complications. Like, this is your health. Like I use sometimes the analogy, you're just going to put a cast on a broken arm and just let it be? Right. Or you're going to not take, you're not going to, like, also some patients are like, I don't want to take an x-ray. Well, you want to break your arm and not take an x-ray of it and make sure that the orthopedic surgeon puts it in the right position? That's not how that works. There needs to be some sort of follow through with a dentist that can make sure that everything's done correctly.
And a thorough, comprehensive exam.
What are your thoughts on
I mean, you really get it. It's back to the same thing, that you need the guidance of professional guidance along the way. Why is it that you think the orthodontists, all those years of doing braces, why did you go back, every 3-5 weeks, whatever it was? You went back to monitor what the situation was, because the situation is constantly changing and maybe need to be reassessed. Now, I know these companies offer, well, we'll give you, you can add more, change more later. But again, it's on your mold, and you sent it in and someone's looked at it and they've changed, sent you some more, aligners or whatever you want to call them. But there's no one is actually taking an active part in monitoring. If you talk to an orthodontist, the person, who's done braces or do these things, they will tell you that it's a re-diagnosis almost every time the person comes in of, well, they moved this way, okay, and I need to make the correction now. Unfortunate with Invisalign and aligners is that just because on the computer screen it said your teeth were going to move here, doesn't mean your teeth really move there. That's why you need us involved as the guidance, because, oh, you know what? Your teeth didn't move the way the computer said it was going to move, because that's not real life, okay? They are moving differently. I need to change my diagnosis and change my treatment, okay? I need the guidance of me to change directions. These other type is there's no direction, there's no guidance. As well as generally they're going to be treating, what we call the social six. Somebody thinks, well, I have crooked teeth, so I want to just straight teeth. Well, most of those aligners will just attempt to correct just the teeth you see in a smile, But like you had said as well, what if there's more underlying problems? And what if so the computer says, well, just straighten these 6 front teeth, but now none of your back teeth touch anymore. Okay? These are the things that can happen. Now, again, this is not in any way, shape, or form saying that these companies, are doing something wrong. Correct. They're providing a service, and on a lot of people, they will work. Okay, but do you want to be the person that it didn't work on?
Yeah. Gerard, I think the interesting thing is we live in a DIY society.
Yes.
And it's, YouTube, access to content, information. There's a funny saying, it's he who treats himself as a patient has a fool as a doctor. So if you think that you can take your own impression, send it out, and then get straight teeth, it may or may not happen, but it may not fall within the boundaries of, great occlusion and aesthetic health. Like you said, the front teeth are straight, but the back teeth aren't touching. Long-term prognosis is what's going to happen. I mean, your joint, you're going to eventually get issues because the back teeth aren't touching, and front teeth will start breaking and cracking, and then you're back to square one, where you may have paid a small nominal fee for straight teeth. Long-term, you're going to be spending a lot more money trying to get back your health, and now you've invested a significant amount of time, significant amount of money, and you're back to square one. Whereas if you would have had a professional overlook, for me, it's point of contact. If you send something out and you get a bunch of, clear liners, who are you going to call when things go bad? You're going to call your dentist down the street that had nothing to do with your clear liners? I can't help you there. I mean, I've had so many cases with companies who I won't mention, and then you come back and then you go back to the question, do you love your smile? Well, I love it too. Back teeth don't touch. And then they come back and then they crack teeth, and then you got to sit down and have that.
We're not sure because I've had cases where they look straightforward. You take them in the mouth, everything is fine, and then they're like, okay, just got to align a little bit, and then you take it through the image, and you see when the teeth have little to no bone, or they have to.
Oh yeah, or facial bone, yeah.
And then these companies are going to make your teeth straight, whether they're moving forward, whatever. They're going to make them straight. That's what they sold you for. So now they move your tooth forward, and you had no bone to hold it.
Outside of the bustle plate, yeah.
Oh, that's happened. I've seen it many times in my office.
Yeah.
Moral of the story, DIY dentistry is not recommended. That's why we have this talk. So I hope this was informative for everyone. Thank you again for listening. Thank you, Dr. Lemongello, for being our guest speaker.
Thank you for coming, Dr. Lemongello.
And we're going to leave our Instagrams for you guys. If you have any questions, feel free to contact any of us. I'm Dr. Melanie Silvestrini at Dr. Melanie Rosalia.
I am Dr. Oscar Sanchez at Dentistry by Oscar.
I am Dr. Barton Santos, DJ to DRB Santos.
I'm Dr. Alfredo Arauz. Instagram is dr.fenti.
My whole mine's the easiest. How about at Dr. Lemongello?
I will also leave a description as well for you guys. Thank you again for listening, and we'll see you next time.
Thank you, guys.